morning, everybody. Good morning, everybody, and welcome to An Impact on Your Health. An Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. An Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. An Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course where we do encourage you to call in to join in. Folks, it's a Friday. It is a typical Friday. We will let you come on in here at any moment to sort of set the agenda. I got a little agenda of my own. I've been really involved with ozone therapy in Western Pennsylvania. If you followed this show, you know that by now. And I thought it was time to share with you how patients are doing with this. And of course, the only way to do that is to bring those actual patients aboard. So I had a couple of my patients actually consent to allow me to bring them to you today and let them tell their story. And because they're some of the first Western Pennsylvania citizens to benefit from ozone therapy, I thought you'd like to hear through their own voices and their own experiences how well it has worked for them, how rapidly. Well, I don't know what they're actually going to say. I just know they're doing extremely well with it, and of course that's why I asked them to come aboard. So if you want to listen with great intention, you could actually be in their spot particularly and have a medical problem that you just can't seem to get resolved any other way. And so we're going to be talking about ozone today, and a couple more words before we get to our first guest right after the first break. Ozone therapy, the Ozone Express. You're going to have to jump on this this express train. It's rolling down the track at a pretty good clip, but there's plenty of room for you too. Now, got to mention that I really enjoyed last night. We were there awful late. I have to apologize if I just couldn't get quiet, but I had a chance to revisit the 7 deadly sins of conventional medicine. Last time I actually made that lecture was in 2007. But we resurrected it, and we relived the past, and then we talked about the future. We updated the whole thing for 2014. And you may want to get a copy of this particular, if you weren't there last night and you think you might get a copy of the 7 Deadly Sins Revisited, actually one of our guests today is the videographer, and we're going to ask him if you have a mind to getting a copy of that, and I think it's a collector's piece by now. There was an original disc made back in 2005, but now it's obsolete. We got a new one because it's got the 2014 updates on it, and 7 Deadly Sins of Conventional Medicine Revisited. Well, as you well know, we're in Top Doc mode, Top Doc Summer. The 20 top alternative doctors in the country met in Phoenix a few weeks ago, and at that time, each of them had written a chapter in a book called The 20 Top Docs, and I was waiting for them as they came off the stage to see if they would come and become a guest of mine and visit us here on the radio show. They all consented to do so, and I'm bringing them at you one at a time. By the way, what did you think of our guest on Wednesday? Dr. Lee Cowden, certainly as a board-certified cardiologist, looked that he was well adept at moving outside the conventional comforts of cardiology. He was in a zone that very few travel. By the way, I'll tell you that off air, because I have had great feedback about Dr. Cowden, his just sincerity rang through the entire hour that we spent with him on Wednesday. But I said, look, two things, Dr. Cowden. One, I'm going to have to bring you back on the show. You're going to have a chance to talk about your cancer prowess and how well you do in treating them, as well as a couple other items that he mentioned he'd like to discuss. So I promise you I will bring Dr. Cowden back. And then number two, I said, look, I'd like to bring in to Pittsburgh to address our groups out here, in particular the Freedom of Choice group. He consented to do that too. So Pittsburghers, you're going to have a chance to benefit and learn more from the great Dr. Lee Cowden, hailing from Texas, but he had a sincerity about him, did he not? That it just resonated, rang true with me as it has done with you. After all, he is one of the 20 top docs. We got up and coming other top docs. Next week, you're going to enjoy 2 days, Mondays and Wednesday. We try to bring you the top docs. On Monday, it is Dr. Bruce Shelton. He is an accomplished physician in the allopathic realm that practices homeopathically in Phoenix, Arizona. We're going to ask him to talk about homeopathy. We were first clued in to this by Dr. Carl Robinson here at the beginning of the month, but we're going to get in depth with homeopathy and some of the unique remedies that Dr. Shelton has personally put together with a company called DesBio. And there are certain problems that require not just one remedy but multiple. And his series, I think, is a unique enough product line that we want to bring it to you and have you hear from the man who put it together exactly what that's all about. Now, that would be on Monday with Dr. Bruce Shelton. Then on Wednesday, and I keep calling him the bad boy, and I don't mean it in any other terms of other than really respect for David Steenbach, because he has been pillared and assaulted by governmental agencies for so many years. It rolls right off of his back. That confidence will be exuded even on the microphone. Every time I watch one of his lectures, it's quite obvious he's got a command of his topic, and he's a force that has taken on the big boys and literally won. He's going to be talking about stem cells, his new passion. Wouldn't say brand new. He's been doing it for over 10 years, and but he's one of the few that has moved along this arena and done so well. I think the explanation of how stem cells can help you right now, and when I'm talking about embryonic ones, where we have to worry about political ideas. We're talking about your own stem cells coming from you, consequently not having any even possibility of reacting adversely with you or against you. David Steenbach, our guest, next Wednesday. Don't forget, too, on the 30th of the month, which is the last day of June, Susie Weiss will be coming aboard with us because she is going to be here in the office first Thursday of the month. That's July 3rd. And in preparation for that, she always has a good message or two. And you have responded out there, Pittsburghers. You keep on attending these free conferences. I usually see 10, 12 at a clip out here, spending an afternoon on Thursdays. Now, this is a free seminar. It is held here in my office. It's at 2 o'clock in the afternoon. So if you've heard Susie before and you want to be involved with this particular one, or if it's one that you'd like to return to, give us a call here in the office so we can reserve a seat for you by dialing us up at 724-942-3002. And that's on July 3rd. Susie will be our guest on June 30th. I'll just flip it into the month of July right now. We have Dr. James Barber, a board-certified plastic surgeon. I've known him for years. He's now involved with genomic testing, cancer screenings. If you have cancers in your family and you're concerned about yourself, there is testing to assess your vulnerabilities, your personal vulnerabilities to display those similar forms of cancer that other family members have succumbed to, and you're able to assess your risk through this new genetic testing, which is available in my office, and by just using a swab, a buccal swab, meaning the inside of the cheek, the mucosal membranes there in the cheek and lining of the mouth, they're able to make those assessments. And we'll have Dr. James Barber talking about genomic cancer screening in the office. And by the way, in the majority of cases, covered by insurances. You're going to want to be aboard with us on July 7th. And on July 14th, one of the top docs actually practices in Phoenix, Arizona. He is a biological dentist. His name is Nicholas Meyer. He's going to be our guest on the 14th as it stands right now. Now, just finished yesterday with our group, our June group, with the eye treatment protocol. And I just got to tell you, as I always do, and I'd say so very proudly, the responses, meaning how well they did in this 3-day program, blew my mind again. You know, we bring you in and we test you on day one, and then we tell them, look, We're going to be doing some aggressive therapies on the third day when we're coming to a conclusion of our program. We're going to retest you again. Not just me retesting you. Dr. Lisa Bowen also retests. She tested the first day and the last. And these people had such great responses. They left with smiles. They came in with the well-viewed fears and anxieties that anyone would if they're losing their vision. Special eye problems such as macular degeneration, whether it's wet or dry, glaucoma, diabetic retinopathy, even cataracts, which have a surgical correction, but who wants that surgery if you can avoid it? Anyway, all four of those can be turned around through this 3-day treatment program put together by Dr. Ed Condrat. We are the local representative. We are the affiliate with Dr. Ed Condrat now, and our results are just, they're stellar. They're what they're expected to be. Ed put the program together so well that anybody can do it, and I'm proud to be part of that affiliation with him. And 4 people left feeling awful good about themselves. For those of you who think you might like to be involved with the next program, which is coming up in July now, the dates for our July program are July 21st, 22nd, and 23rd. Plenty of time if you think you'd like to be involved to get all of your records in, to get them sent off to Ed, because he is involved with every single eye case that we do. And before we can start, Ed has to be able to evaluate the record and make sure the microcurrent devices are programmed with you in mind and customized for you. And so 21st, 22nd, 23rd, if you think you might like to be a part of this, if you'd like to maybe explore it more, give us a call here at the office at 724-942-3002. Ask for Sarah, and Sister Sarah will be putting you on track for our July program, 21, 22, and 23. Now, it's about ready to take that first break, and just to lay the proper setting here. Since April, we have been utilizing legally, and I want to underline that word legally because it's not been a criminal offense, but it certainly has been an ethical offense in the state of Pennsylvania to do ozone therapy. So said the state medical boards for years. But in April that changed. The FDA now grants us an IRB. That's an institutional review board, and for investigational purposes, we are legally here in this office allowed to dispense it, and have been doing so with wondrous results. Now, Dr. Frank Schallenberger introduced us to this particular way of treating you. The famous Schallenberger shows that we did are a primer to all this. I suggest you go to my website. On the opening page, you click on the icon marked Archives, and when YouTube, because it takes you right to the YouTube, comes up, type in the search engine Courtney / Schallenberger / Ozone, and then there are. The 3 shows come up. They're called, oddly enough, Ozone 1, 2, and 3. Listen to those 3 shows, and if you needed to know more about it at this moment, I think those 3 shows will help fill that in. Well, people have responded. They've come in. They've asked to receive the ozone, and they'd like to talk about it, or at least I've asked them if we can talk about it, and that's what we're going to do. We're going to take a short break. We're going to get to one of our first patients who've received ozone therapy. We'll let her tell her story, and then we're going to take a break about 20 of the hour. We have one other patient that's going to come aboard today to talk about how they're doing with ozone therapy through their own speech and expression. We'll be back in a moment with our first guest.
you turn to food.
Okay, we got her. You can talk to her briefly.
Okay.
Press N.
Good morning, Donna.
Good morning.
Hey, so nice to allow us to invade your morning and coming aboard today. This is going to be a piece of cake. I'm going to fire at you some of these softball questions that you'll be able to answer, no problem. Sort of lead you down to just responding the way you would. We've already talked so much about how you did, what happened to you, and what kind of pain problems developed, and all the things that you tried, and that's usually a good start. And then why you decided to do Ozone. They're just the common things that one might want to ask you. You'll do just fine, and then I'll let you tell your story about how well you're doing now, okay?
Okay.
All right, we're going to probably do this for at least about 20 of the hour. So we've got, here we go, hang on.
Okay.
Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9. I'm Dr. Dennis Courtney with you on a Friday morning version of the show, and it's sort of a new series we'd like to launch today. We're doing so much with this ozone therapy treatment that I felt that an important part of this should be to have an opportunity to hear from patients and how they feel they're doing with ozone treatments. I feel, from a clinician viewpoint, that it's a home run in just about every case I'm involved with, but you need to hear it from what we'll say the horse's mouth. And so today, one of my patients has allowed us to invade her morning and sort of tell her story about why it is that she needed my help, what it was that maybe didn't work before, and how it is now that things may be changing for her. Her name is Donna. She is just been so nice and with kind words when she's talking to me. You're going to appreciate Donna telling her story. Donna, good morning, and thanks for coming aboard today.
Thank you.
My invite was received quite nicely by you, and of course, most patients who are seeking medical help do so because they've got problems that don't seem to get resolved. And I want you, if we could, to first of all, I think very helpful in this is to know your profession. It's very unique for a woman, and it's quite unique in terms of the job classifications. I've heard you are a jeweler. Am I correct?
Yes, that's right.
And I think that working on a bench, or I don't know what you describe your work area as. To me, I can envision you sitting at a bench with
right.
your arms sort of raised up in front of you and postured. Or describe your workstation, because I think it played a large role in why you were having the problems that you were. Go ahead.
Yeah, I lift my arms most of the day, and I had been experiencing some pain in my right arm, and that's my dominant arm, and the shoulder started to really act up, and I couldn't move, I couldn't bend it, I couldn't scratch my back, and so I had heard you on the radio, and I couldn't wait till you got this, You
were waiting. Okay. Let's back up just a bit and don't get too far ahead of ourselves, because a while back, some traumatic things happened to you which created a problem. We want to elaborate so our listeners get a feel for why it was that you needed my help. But why don't you take us back to, was it a motor vehicle accident? Is that what it was?
No, it was an accident in the house, and I'd fallen and landed on the shoulder.
Okay, and landed on your shoulder. And how long ago was that?
A couple years ago.
Okay.
So I suffered, and it just got worse and worse and worse.
Now, falling like that, the trauma obviously has a chance to injure tissue, and probably for a while it was no surprise with the way you must have struck the ground that you were having pain. But this was pain that just didn't seem to ever go away.
Yeah.
What were the attempts that you used and the professional help that you sought to try to resolve this problem? Give our listeners a good idea of how you were out there searching for something to help you, and how effective those modalities may have been.
Well, I had gone to massage therapy. I'd gone to chiropractors. and no one could give me any relief. And they wanted to give me cortisone shots, and I just did not want that. And I heard you on the radio, and I wanted that ozone therapy, and it made so much sense with the doctor, Dr. Schallenberger talking about, how it works, and it did.
Well, Dr. Schallenberg has a way with words, does he not? But
Yes.
He has a sincerity that also, talking about Dr. Cowden earlier, they both have a sincerity that just rings so true that the man's not trying to pull the wool over anybody's eyes. So
It's common sense.
yeah, and so Dr. Schallenberger's got a lot of people's attention, and I'm sure glad to hear you were one of them. So there you were sitting out there hearing about ozone. Had you ever heard of it before?
Never.
Never had heard of it, as so many in Pennsylvania had not.
Yeah.
And you said I want to do that, huh? You said you wanted to do it. Now, for people who have chronic pain in various areas of the body, we have a certain protocol here. Sometimes patients don't really like this protocol. Sometimes, and I'll let you tell your story in a moment, but if anybody has a chronic pain problem, the first thing they need to do with the protocol we're using here is they have to subject themselves to major autohemotherapy, which is one of the ways of administering ozone, which is giving it IV for 3 treatments first. And then on the 4th treatment, we'll spend a day spending time to treat all scars, all trigger points, and all pertinent subcutaneous areas. And then the prolozone that Dr. Schallenberger talked about will occur. I guess that will be the fifth appointment. So people come in thinking, I want to get right at this prolozone, and sometimes they really don't like hearing from me how this protocol is going to work in my office. But you got through that okay, and you said, okay, sign me up. And so the first day that we meet to do our major autohemotherapy, which is the IV procedure that we did where we administer the ozone, I pretty much look at this as one of the prerequisites. I'm not really expecting that everybody's going to do wonderful on it, but you tell me how things went on that first day. How was it a scary thing to get this ozone treatment at all?
No.
You didn't think so? Okay, that's good. Some people just have a revulsion against needles or anything intravenous, but this wasn't painful or uncomfortable in any way, correct?
Not at all. Not at all.
Okay, so came in, you're sat in one of our very soft chairs, and we administered the ozone. Pretty quick treatment, isn't it? 10 or 15 minutes and gone. Done.
Yeah, it was actually cooling. It was actually cool. Like when it
went back in the body, you mean it was a cool? Yeah.
It was refreshing.
Okay, and so I don't expect anyone during the moment of receiving it should have any different sensations. After the treatment is over and the IV's discontinued, you leave. Now, at this point, I'm all ears because I haven't even asked you in the way that I'm asking you now. Why don't you take us through what you experienced after you left that day, when things maybe started to change for you, how they did change, because it was your right shoulder that has been causing you all this pain and discomfort as a jeweler handling some pretty expensive merchandise. And I don't know, I don't know if you're setting, I don't know if you're making settings out of these or whatever, but nonetheless, your employer probably wants you to be up to 100%, and you had not been. So tell us how things went.
Well, I went back to work, and it
left me and went right to work, huh?
Yeah, I went right back to work, and I didn't have any problems. I didn't experience any problems. And then as the day progressed, I noticed that, like, I reached for something and I had no pain, where before I could not reach with my right arm.
Get out of here.
My husband was so surprised. He said, I can't believe you did that. And before I couldn't get down onto the floor and get back up, not easily, And I just went laid on the floor with my pets and got right back up. And I haven't experienced anything negative at all. And it just seemed to have gotten better. So
Well, let me ask you this question, because we will continually ask each and every patient as they, because you only had one IV treatment so far, correct?
Right.
Just one. And we got 2 more probably up and coming in the near future. And for our listeners, one of the constant questions that we ask as a patient returns is, okay, tell us what percentage of improvement, we'll say to them, what percentage have you improved over and above where you were at the last time? Well, the last time was your first time.
Right.
And so, being your first time, I'll now ask you in a way I haven't had an opportunity to ask you yet, because I haven't seen you since your first treatment. But as I ask you this question, hey, Donna, how much improvement have you had with that chronic pain problem, which was a pretty severe problem for you, limiting you in a number of ways? What percentage of improvement did you get with this first IV?
I would definitely say about 80%.
80%.
Yeah, 80%.
My mouth is dropping right now, and maybe the mouths of a lot of people who are listening to you, because having a 2-year problem that just languished there was affecting your work, your home, your ability to play with your animals, I guess, and to have 80% turned around with a generalized IV, that has set a tripwire now. I've marked it down, and we'll certainly enter it in your chart when we see you next. But do your family members and your employer, your co-employee employees, do they say, "Well, you got it? Are you kidding me? Do they believe you?"
They have no reason not to. I have no lies. I'm not lying to them. They know that I've told them over the decade, look at my arm, look at my arm. My girlfriend, she knows me at work, and I've showed her all the different things. I thought, I was never going to get my arm behind my back again. I thought I'd never get my arm over my head. And I just thought I was going to live with it, the pain that I showed them, what I could do. There was a piece of equipment that I couldn't use at work, and I can use it now. So
wonderful.
I'm really pleased.
Well, I know, we ended up seeing your husband. By the way, I should say, and I hope you don't mind me sort of revealing what may unfold for someone else. The husband got very excited too, because he's lived with you all this time, and he knows what kind of agony you've gone through. He has his own agony issues, but what's happened to him is hearing about you, he said, "Oh boy, I'm going on. I'm going to get this thing done too." Right?
Right.
Now we should report to our listeners that he already had his first IV, and he didn't get much of a benefit at all, did he?
Not much. He has some benefit. His fingers and his elbows, they don't hurt, and that is a big thing right there. His back is really.
Yeah, I know that your husband, if you asked him to rate his pain and where it is the worst, it's his back that the main focus is. And ultimately, when we get to the Ozone component of this, we're going to be injecting ozone directly into the joints of the lower back and the mid back, of course. But we're trying to get through this protocol. Look at what happens in your case, and it just points out for our listeners that it works differently for different people. What isn't going to be debatable, however, is we're going to win in every case. We're going to get this pain turned around. I'm so pleased that you actually were able to, right out of the chute, and I think that's unusual. And maybe your husband is actually more typical than he is atypical, because he's got some good relief in some areas, but his main area of agony wasn't touched. Now we got 2 more IV treatments to go for him. We actually have 2 more to go for you, but I think what might happen for our listeners to understand this, if you're 80% better, and it's held for, is it going on 1 week or 2 now? How long has it been?
It'll be 2 weeks next week. Okay,
and it's held on to that degree of improvement for these 2 weeks.
Oh, it's unreal.
Oh boy. Okay. So.
I'm so confused. I couldn't lay on my shoulders. I couldn't turn on my side. I had to, lay like on my back, and now I can turn and have the discomfort.
Oh, I'm so tickled for you. So it looks as though what might very well happen here, and I haven't shared this with you yet. If I have, then at least this should be confirmatory. If we should happen to get through our 3 IVs, and by the time we've reached the 3rd one, you can say to me, you know what? All of my pain is gone now. I mean, it's like 100% relief. Then actually we won't need to get to the scar injections nor the Ozone, and this will be done.
Yeah.
And that's pretty amazing to think that it could be done without ever getting to the shoulder itself. And so for those of you out there who are contemplating this, you should know that through this protocol, once we've achieved the objective, which is to get you pain-free, wherever we are in the protocol, we can pull that thing to an abrupt conclusion. We don't need to move into additional treatments. I like the idea that Frank Schallenberger has proposed, which is no matter what the pain problem, it's 4 and done. 4 treatments and done. Now that means the Ozone, we're not even there yet. We may not ever need to get there because we're at the IV component, and I'm going to keep my fingers crossed for you that you won't even need to get local injections in the shoulder. But if you do, okay, so be it. How are you thinking? When are we going to see you for your next treatment here, my dear?
Next Friday.
Next Friday.
Yes.
All right, well, I'm going to keep my fingers crossed that you're going to have a continued 80% relief factor in play, and then we're going to get that other 20%. I'd like to think that we can get it through the major autohemotherapy approach. I actually think it's going to be possible in your case. And then we'll continue to work with your husband, who seems like he's a more typical responder, and ultimately we'll get to his problem too.
Right.
Is there anything, now you've got the microphone in a sense, and you've explained how it's worked for you. What would you say to listeners right now who are sitting back? You appear to just run toward this like a freight train yourself. They may be sitting back and they're a little more reluctant, which is understandable. What words of encouragement would you like to pass on to them? And I'll give you the mic. Take it away.
Okay, well, I know that a lot of people have experienced pain in their shoulders and in various other areas. And they run to the doctor, the regular conventional doctor who wants to cut you, wants to do an operation. And everyone that I know that has done that, has experienced quite a few problems, a lot of downtime, and I can't take off time. And not like that. And I don't want to. I don't want to be, crippled up, trying to recover from surgery. And I don't have the time for that. And I thought, what can this do? How hard can this be? And it sounded so common sense, and it made so much sense to me. And I thought, why not? Try it. Do it. It can't hurt. And it didn't. And it helped. So
Boy, did it ever.
I would say everyone give it a shot. It's remarkable. Why suffer?
Why suffer? And certainly, even if you had a successful surgery, you mentioned the recuperation time. There's just no way you can walk out of surgery and be fine the next day. You've got to have weeks of coming back. Even if the surgery was successful in alleviating the pain, the post-op discomfort that you can expect with it, and you're saying, look, I can't do that. My job and what I do, this just won't work. And then, of course, there's always the possibility that you could have had a surgery, and it would have done no good at all. In fact, I'm going to guess, probably be accurate in this, that if you would have ever consented to having that surgery that was recommended, I don't believe it would have helped at all, because your problem was an inflammatory problem, and surgery isn't there to correct inflammatory problems. They're there to correct anatomical problems, and yours isn't anatomical. Right. So, anyway, Donna, thank you for coming aboard today. Thanks for allowing me to share with my listeners your story. Each and every one of them has their own story out there. Hopefully they can be encouraged by your words. I know I'm very excited by your words. Look forward to seeing you next Friday for treatment number 2 and trying to knock 100% of this pain out before the 3 IVs are over with. Okay?
Okay. Thank you very much.
Thank you, Donna. Have a wonderful week, my dear. See you next week.
Bye.
There you have it. Donna. So, got a pretty fantastic story there. Unusual, I think. Yes, I think the case is unusual. Such intense pain, able to be treated. I think if I heard her right, when she left me on the day of the treatment, she went to work. Who ever heard of leaving a treatment, going right to work, and putting yourself through the paces of your work and finding out while you're going through what has been a challenge for you, you're performing tasks that you have pretty much assured yourself that you can't do. And there you were the same afternoon doing them with vim, vigor, and without pain and discomfort. Anyway, I tip my hat off to Donna and looking forward to getting her the rest of the way. Okay, going to take a short break. And when we come back, let's get to patient number 2, a gentleman with his own story. We're going to ask him about how he's doing. And the course that he took is a little different. Well, it's a lot different than Donna, but he's on course, I believe, and on track to get the similar results that Donna has gotten on her particular problem. Be back in a moment with Peter.
This is Dennis J. Courtney.
Okay, we got him. Hold on.
Oh, this is working so smooth. I
Yeah,
can't stand it.
so he answered right away. I was hoping he would. All right, hold on.
Sure.
On the radio, another expert has yet another.
Peter,
Hey, good morning, Dennis. Rock and roll, man.
rock and roll. Are you listening to the show?
Yes.
All right,
I
so.
need to know what the run-up is because I didn't have those reactions, you know. And
Oh, no, your story's different.
I'm going to be candid because, you know, mine's a bone-on-bone thing and hers is a muscle thing. And so,
Oh, hey, I'll let you make you're going to tell your story the way you tell it.
okay.
And I'll feed you the questions, similar pattern of questions, and however you answer them, hey, you answer it that way, okay?
That'll be great.
All right, hang loose. We're going to be at it. By the way, I'm going to ask, do you want me to mention about the 7 deadly sins, the tape, if the people want to get one of those?
No.
Huh?
No.
Okay, won't do it.
Thanks. And
Here we go.
I'll find you later.
Okay, here we go. Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. Dr. Dennis Courtney with you today on a Friday morning version of the show. It's in a new installment here. Ozone therapy has overtaken us all. I'm very enthralled with the capability of being to help people in a way that I've been unable to do for so many years now. And I thought it would be very nice to be bringing patients who are experiencing the pain and the benefit to let them share their story with you. I'm going to bring a gentleman to you now who has a completely different story, a completely different set of pain problems, and we're going to find out how he's responded to ozone therapy. I present to you Peter. Good morning, Peter, and welcome aboard.
Good morning, Dr. Courtney.
Hey, Peter, thanks for allowing me to invade your morning, and I wanted to give you the opportunity to tell your story, and it's going to be, ladies and gentlemen, completely different than Donna's story. I'm sure everybody's story is, but Peter, can we start out with what your pain problem consisted of and how it is that it happened that you had such a pain problem? Take it away from your words and your angle.
My pain problem and Donna's are night and day.
Okay.
I was involved in an automobile accident. In trying to avoid the accident, I put so much pressure on the brakes that when I did make impact, it drove my legs right up and dislocated at the hip, and I would say compressed really hard on the ankles.
You get a kick from the brake pedal with the impact of the accident. Is that a fair assessment?
Yes.
And it was so violent that it jammed
everything I could to hit the skids, and cars nowadays don't skid. So it's just the harder you apply, that's all you can do. But you can't avoid an impact, and you're going to take a beating as a result.
Now, how long ago? When in time frame was this accident? When was it?
This happened in October of last year.
So, in terms of length of time, this is still relatively recent. But after 3 months, and this is just a little word for all listeners out there who may have a trauma, maybe comparative trauma, or maybe something completely different. But with any traumatic event leading to damage to tissue, there's a 3-month window of time where, goodness gracious, it's just expected that you're going to have pain. But in the 3-month window, you should be evolving and healing to the point that when the 3 months is over, there shouldn't be any more pain. Or if there is, you got a real problem. So you said October, November, sometime at the end of January, Peter. I guess not much had changed in what your pain complex was, huh?
Nothing had changed. Yes, we do have a real problem.
Sure.
And I was walking around with a severe limp, used a cane on multiple occasions, and would see a chiropractor who would do some adjustments and did ease the pain in my hips, but my ankles were never a factor in that. I've avoided any idea of doing the steroid cortisone route because of the degradation it causes on the joint. And so when I saw the Ozone flyer that you and the 20 top docs were going to meet, and what the certain subject matter was, the one that just stood out to me was Schallenberger.
Oh yeah.
And that's when I just lit up and paid attention. I've always been a fan of Ozone. I have my own ozone generator for other applications, and hydrogen peroxide. So that oxygen molecule is pretty cool, let me say.
That is a pretty cool thing, huh?
And so when I did read that you all were meeting out there in Arizona, I had to call you. You and I have known each other for a little bit over a year, and I've always respected your straightforwardness, and I definitely respect your intellect. I mean, you're so, as you used the word earlier, sincere in your approach, and you're straight up to the questions I ask. I come from a medical family, and the fact that you are the only doctor I've ever heard who says advocacy when you have a problem is essential. But I didn't need one because I understood what you said in your answers, and I just became one of those guys who were chafing at the bit to wait to get the
it would be the first time. By the way, I think
I annoyed your secretary. And, oh, where are we?
Yeah, that's a cute little aside, because there really has to be a first. If you weren't the first, were you? I think you were the second patient, right?
I was second. Yes.
Number 2. Now, never take that personal. It's just the way that the schedule worked out. But you were one of the first to receive ozone therapy. And so, as the protocol was elaborated to you, we had mentioned we're going to do 3 IV treatments, then a day doing scar injections, and then we're going to get to the first prolozone. So here you go. You made that decision after hearing Frank and knowing that you weren't making any progress with anything else you were doing. By the way, I can recall pulling into a parking lot and watching an individual, I don't know what that was coming across the street to walk into the building was, but when I saw it was you, it hit me right in the gut, Peter, okay? And I had to mention something to you. That was just terrible. on how you were afflicted, and really your ambulation was so intervened with that you couldn't even cross the street without looking like you were 80 years old, Peter. I mean,
you're exactly right.
And you're a young guy.
And I have never had an injury of this type where it didn't just heal, go away, and you're back to normal. This has been turned into a chronic problem, and the ozone, from what I had read, and I dug deeply into it, I said, this is my answer. So I just, and to find out that you're the only physician in Pennsylvania who does it, and you're a Pittsburgher, is even more of a sign. I mean, as they say, there's your sign.
And lined up. The planets were in alignment.
Oh, my gosh.
Looks like it was a go. So it was a go for you. And we accomplished our first 3 IV treatments with you. And why don't you tell our listeners how they went for you? How did it work?
The first 3 IV treatments were a positive delight. To say an IV treatment is delightful. Like the earlier caller said, it was very pleasant because it had a cooling effect that I never expected. That was it felt good and it was relaxing, and I just watched the whole procedure and was fascinated how it all occurred. You know, step by step, everything has to be timed, and you're right. 15 minutes, it was over.
Over. Now let me ask you this question, Peter.
So for me, each procedure, which we did in kind of rapid fire because we were allowed to, on me had relatively little effect.
Little effect. So if I asked, and I know I did ask, by the conclusion of the first 3 IV treatments, what percentage of improvement had those 3 treatments altogether provided you? How much percentage of improvement?
I'm not proud to say this, but I have to explain. I have a different tolerance level to procedures sometimes than other people do. And so to me it wasn't a surprise because I felt that with the IV treatment that by the time it got all diluted and stuff and got down to my ankles, would
you say there was no improvement?
Relatively
none.
Oh, yes.
Okay, so fair assessment would be after 3 IV treatments, unlike Donna, who, that afternoon was in their work doing all sorts of wonderful things, you had 3 IV treatments with really no response. But you maintained that positive attitude. I hope I continue to encourage you to don't give up the ship. The next treatment I thought was really interesting, though, because that's the day we were supposed to inject scars, associated subcutaneous regions, and trigger points. And you got to take that one over because you had a number of scars, one right in the very ankle region that we're talking about. And so, ladies and gentlemen, we have to sort of break the tug that happens whenever you pull a fascia together with a suture that a surgeon puts in, and that's not a good thing in terms of disturbing the body's ability to respond by these tugs. And so, when we inject your scars, how did that treatment go, Peter?
That treatment was amazing. Because I was able to watch and see what you saw and also what you did. And as you explained it along the way, it just made all kinds of good sense. I have scars all the way from my feet to the top of my head. And
I injected them all.
And they got them all. I mean, I even had them in my face. And so you might say it was top to bottom scar injections. And the common denominator was that although I could feel the solution going in, there was no pain. It was a procedure that was, to me, fascinating, absolutely, and especially when you did my face. And but the area of our target area, my ankle, it was to be able to see the solution and what it reacted, and to feel it as it did, it just made such common sense to break it, to address that before you go.
Yeah, I know. So it gets first people off guard. Do you want to inject my scars and my ankle? Like say my ankle hurts, and you're injecting my scar, my hysterectomy scar. It doesn't like resonate. Okay, not that you had a hysterectomy scar, but sometimes these scars are close to where the pain is experienced. Sometimes they're very far away. But the fascia that's pulled together with a surgical knot tugs at great distances away in a similar way that I described. I think I've used the description with you, like a form-fitted sheet on a bed. There's not a wrinkle on that sheet, but if you take the corner and grasp it and just pull a bit, you see a stress line run through the entire sheet down to the opposite corner. That's my best explanation.
And that's the analogy was brilliant because it just gets everybody can, or at least in my case, common sense. You just see it right away, and that is the explanation that just leads you to say, "I got you."
Gotcha.
Do it.
Okay, so with that treatment, I will say you amazed me because it only takes. What do we take, 10 minutes there? And
probably not, yeah.
And we're just in the superficial. We're only just underneath the skin. And when you stood up, Peter, your pain was gone. And
yes.
It was completely gone.
That was a surreal moment. That was totally unexpected.
Totally unexpected from my perspective.
Never even imagined, if you will, because wherever had you ever heard, seen, or experienced, you go in, you have a short procedure, and you get up off the table, and your pain is gone.
Yeah. It was an emotional day that day was, and because you could feel that there was this. You had bet the ranch on this and said this is going to work, and you could see that your decision was right. Mm-hmm. The complete pain freeness that you experienced was not long lasting, however. How long did it take before that deteriorated considerably and maybe went completely away? Describe the days after you left me.
The initial pain-free mode over the next several days continued to go backwards.
It eroded.
And then it kind of leveled off at about what I would say is the 40% mark, 4 to 5 out of 10.
Well, that's still, by the way, so
not at all unnerving and actually fully expected. I mean, it went from what I know it's going to be at the end to what I call a natural building block process.
I think that's a very realistic way of looking at it. So you get 40% improvement with just the scar injections. We came to the first Ozone, and I think you were the first to get Ozone. Okay, I think you were the first. And so that means we injected ozone directly into that ankle joint there, and obviously at the end, I fully expect, as I tell everybody, when I'm done today, you don't leave unless whatever your pain is completely gone. It's going to be my check and balance that I've done the job adequately, I've placed the ozone in the right spot, and to hear the feedback from the patient is that this doesn't hurt anymore at all is what I need to hear to know that I've scored where I needed to score. And I'm not saying it's going to remain that way, but at least I know I can let you go and let nature take its course. So having achieved what I thought to be my objective on the first Ozone, days then ensued, and what happened, Peter?
Well, after the first Ozone, and you spoke those almost exact same words that you expected, you don't leave until the pain is gone, was kind of a lead up to, what the heck's going on here? This guy's so confident that he knows that this pain is going to be gone, and I haven't even gotten off the table yet. And I'll be darned. Get off the table, onto my 2 feet, and voila, I was
On a cloud.
on a cloud. I walked out, down the hallway, no limp, into the waiting room, talked to the people I'd been going there. I said, "You see a limp, guys?" And I walked back, and I hugged every girl who was in there.
Yes, you did. I'm going to accelerate your log because I want you to get your whole story before the program ends. So
Okay.
let's say, of course, the complete pain-freeness of that Prolozone injection didn't last to the 100% level that you left me with that day. So you did come in the following week. We were sort of on a little project here because there was an impending date. Your son was getting married.
Yes.
And we wanted to see you at that wedding be at your optimal. So I saw you on a Friday for a wedding that was going to be on a Saturday. And I didn't know until last night how things went. But now I report you've had your second Prolozone therapy. Where does it stand now, Peter?
Well, you had told me that I would be able to dance with my daughter at that wedding because she does like to cut the rug, if you will, and I fully was able to keep up with her and enjoy the entire day and not have the literally piercing pain that I had suffered through for all these months. And you called it right, and you were spot on. And after anybody's on their feet for that long, there's going to be the next day you're kind of.
Oh yeah, you pushed it.
Yeah.
You pushed it, but we knew you were going to push it. So Peter, look.
And so, but it's still leveled off at a higher plateau than after the first one.
So as it stands right now, Peter, what total percentage of relief do you have overall with your ankle pain from your start to this day? To this 50-60%. Folks, what a great crescendo moment. Peter, there are bongos in the background. We're going to leave you today.
Thank you.
We're going to leave you today with on bated breath, waiting to find out. By the way, I'm going to bring you back, Peter, when we're 100%, okay?
Yes.
When it's all gone. Ladies and gentlemen, that's Peter's story, as only he can tell it. I'll be with you on Monday. Don't forget, Dr. Bruce Sheldon was going to be with me. We'll do more of these Ozone shows, folks. I think you need to hear from the lips of these patients how well they're doing. So until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.